Good morning.
Good morning, Louise.
Now let me change my video because if it's going to be blurry, you're not going to see anything that I'm doing. Second. There we go. Oh, there's quite a few of you on here. Great. I'll wait another minute just to see if anybody else comes on.
Is everyone's houses okay? Any leakage? Any damage? Where are the
My side,
leakage?
all fine. There's weird noises. Can definitely hear a lot of. There's a lot of sound, so we're up quite a bit in the night just checking everything's fine. But it seems okay. Right, let's get started. All right. Well, thank you everybody for coming along. Much appreciated. The purpose of today is to introduce mobility. I know we do it at the start of classes, but to introduce it more in depth to everybody. It's obviously good for warm-up prep. It's really good for injury prevention. And it's really good as well for increasing your strength because you're getting more movement through the joint, which means you're able to get more movement through the muscle. And it'll help to kind of push past any limitations through that as well. If anybody is uncomfortable with the position that they're in, stop. Most important part really is your breathing. Throughout of it is breathing and moving slowly through any of the movements as we go. Today we'll do more of a hip mobility, lower body mobility session in light of us not being able to do leg strength today. But it is known that I actually was doing assessment this week whereby I did an assessment looking at somebody's hips, and there was incredible tightness in the left hip, which once we worked on actually relieved the shoulder pain and discomfort that had been coming in from the right shoulder. And it was a limitation that someone was not able to do any overhead pressing, and a lot of it was coming from their left hip. So just as a heads up, you might have some relief elsewhere as well. Right, okay, let me make sure that you can all see this properly. Right, okay, so just to start off with, if everybody can get themselves down into a squat position. So everyone down to squat. If you are able to get yourself your feet pointing forwards, that would be fantastic. If they're coming out slightly, all good, but just get yourself into a deep squat, okay? And in this position, we're going to go into some deep breathing. So taking a large breath in and a large breath out. If it's very uncomfortable, you can take your feet that little bit wider. Same again, adjust your feet. But in order to be able to help your body relax and get comfortable in a position and to be more mobile in that position, you have to be able to breathe into it and to tell your body that it's a safe position for you to be in. So just long, deep breaths in here. And if you can keep your chest up nice and long, you're creating space through the rib cage as well. And have a move around here. Just move side to side. Try and keep the heels down, but we're moving side to side as much as we can. You might feel a little bit tight through the ankles there. So we're going to lean forward slightly, coming up onto the toes, and then just pedaling out through the feet. So pedaling out through your feet, again, you get some movement through the hips there, keeping that head and chest up, breathing consistently through it as you go. And coming up high onto the toes, so get movement through the toes if you can. And then you're sitting back down again into that deep squat. And again, just breathing into that position. Okay, and then slowly coming up, taking your feet even wider. Again, if you can put your feet pointing forwards, that would be great. If they're slightly turned out, again, all good. But sitting down into that squat this time, that a little bit wider, so your feet might be at the edges of the mat, or if you've got a mat. And then elbows coming in. And do as you wish with your hands. Obviously, prayer position or clasping are a bit easier. And again, breathing through here. So what we're doing here is we're decompressing through the lower back, getting into those hips as well, and also telling the ankles that this is an okay position to be in. It's not often we typically spend this much time through the ankles with an ankle flexion like this either. So I'll move around, see how your hips feel today. Breathe as you're doing it consistently. Take really long breaths. Let your body know that that's an all right position to be in. And then from there, pressing your elbow in, and then you can rotate over that opposite shoulder. So when we're doing this, as we're creating length all the way, so big long breaths. If at any point in time you need to come up, give your legs a shake, and then come back into position, please do. Don't be in a position that's particularly uncomfortable for you. Long breaths are creating space from your tailbone up through the ribs, so keep that chest up nice and long. You're going to do 3 really long, deep breaths in this position here. Again, like I say, if this is uncomfortable, stand yourself up, adjust your position, and then we're going to swap over to the other side. So again, pressing that elbow in, you can use your other hand to leverage off the other knee. Long breaths in, and then try and relax through the ankle as well. If you've ever had any ankle injuries or twisting, it might be more uncomfortable on one side or tighter on one side over the other side. Big breaths in here like that. Okay, and then you're slowly going to roll yourself up and give your legs a bit of a shake. Good job. See how that's feeling. Just moving from side to side through the hips. Taking yourself down if you feel like you need to. Then you're going to take a slightly wider stance, again, toes pointing forwards. You're going to just hang out here. So moving through the hips again, so toes point forwards, wide stance. Move from side to side. Twist through the hips. Let's decompress through that lower back as well. As I said, with the shoulder, the hips relating to the shoulder, obviously most notably, the hips will relate to your lower back. So for those of you that were in class yesterday and we had a lot of bent over rows, yes, we have core engagement that will help with the reduction of lower back pain. But if you have particularly tight hips, you're going to feel more uncomfortable as well. So just rocking back and forwards there. See if we can get some deep breaths into that position as well. And then from here, we're going to lock the legs out. So you're going to squeeze your quads. And if you need to come up, that's okay. So you can put your hands on your hips. But you're going to squeeze your quads. Get length through your lower back. Deep breath in this position. And then relax. And then relax through the knees. So we're going to get a few more contract and relaxing through the hamstrings, through the quads. So you can bring yourself up, whether it's on the mat or up onto your hips. You're going to squeeze your quads. Again, keep breathing in this position. Keep breathing. And relax. And then again, just pedaling those feet out. And then we're going to do that once more. So we're contracting those muscles. So squeeze. Let's get that tension through. Again, consistently breathing through it. And relax. Good job. And then coming back slowly down onto the mat. Great. Okay, so now we're going to go a little bit deeper into the hips and hamstrings. If anybody can't hear me, just let me know. I'm assuming that you all can because you're all following along. Right, let's go with one leg forward first. So whichever leg you would prefer to start with. So knees and feet are hip width apart. For this one, your big toe of your front foot must stay down. So we're stacking the ankle with the knee and your hands are on the insides of your hips. So this is one that we would typically do during classes, at the start of classes. It's called the world's greatest stretch for a reason. We're getting a lot of movement into the hips in this position. So rock back and forwards, rock side to side. See how your hips are feeling today. If there's any sticking point, just breathe into that position. And then a long breath out. When you breathe out into that position, again, you're allowing the body to know that that's a safe position and that you own that position and you own that depth through that joint and through that muscle. So you can be on the top of your back foot, so you're not stressing through the toes or the feet or anything. And then again, just moving through here, side to side. We're going to go a bit deeper into that. So you're going to bring your foot into your midline of your body. So foot into the midline of your body. So you're going to come a bit closer. You're welcome to have your hand at the other side if it's more comfortable. It's entirely up to you. But most important thing, again, keeping that big toe down. And again, just moving side to side. You might want to twist a little bit, but keeping that big toe of your front foot down, making sure that your ankle is underneath the knee. If you need to adjust where that front foot is, you might, by this point, be able to come forwards a little bit more. We're opening up through the tissues, all the way through from the glutes of your front foot into the hip flexor of your back foot. And then from there, keeping your feet exactly where they are, the hand of the opposite, the hand of the leg that's back, we're going to create a really long length from this side all the way through to this other shoulder. So you're going to stretch as far forward as you can. So we're opening up through the tissue from your foot through your hip. And again, breathing into this position. And you're going to put your other hand onto the knee and we're going to twist. So we're opening up through the hip. I'll move sideways so you can see a little bit better. So we're opening up all the way through this hip into this shoulder, your rib cage. And again, really long, deep breaths into this position. Opening up that chest. You might feel that through the adductors a little bit as well, especially on the front leg. Long, deep breaths into this position. And then you're going to come back to the center. Keep your feet exactly where they are. But you're going to now stretch over to the other side. Creating length from this hip all the way through to the other shoulder. And keeping that toe down of the front foot, you're going to drop that knee out as if you're pushing something away. And again, really long, deep breaths into this position. Ease yourself out of it if it's too uncomfortable. Again, just move around slowly. Move gradually into this position. Take it steady and be kind to your body. If it's too uncomfortable, your body will react and tighten up even more. I'm going to stay here. You should be feeling this through the glute as well of that front foot, or front leg rather. And then you're going to come back to the center. And then from there, we're going to go bring your front foot back into the center even more. And then you are going to go into the edge, knife edge of that foot. Okay, so we're going to move around here. So we're going to butterfly the legs slightly. It's almost like you're in a cross-legged position. Slowly going into that hip. You're breathing. What's funny, the only person that I have on large screen here is Siobhan. So I'm seeing Siobhan. It's like we're doing a one-on class, Siobhan. I can see some other people in the top, but it's just like you and I are having a one-on-one session. I can see this one's a fun one for you. So just pushing that heel into the ground, butterflying that leg, getting right into your glute here. Sorry, Steph's now taken over your position, so you're all good. And then slowly bringing yourself up back into that lunge, and you can relax slightly into this. Just coming up, just shaking out, moving around, seeing how you're feeling here. Now we're going to stay on this same side. We're going to come up onto the back foot. Again, if any of you were in class yesterday, we did this one. So you're going to squeeze your glute of your back leg. I'll just show you from the side again. Squeeze the glute of the back leg. Squeeze the quad. Now, I'm going to keep them tight as I can. So I'm going to contract everything. I'm going to breathe because I need to make sure that's a safe position. And then I'm going to press my back knee down towards the ground, but only go as far as I can with that glute and quad engaged. And then I'm going to come back up. Make sure they're squeezed tight again. I'll go down as far as I feel like I can. And then I'm going to come back up. Only go down to as far as you can. What we're trying to do is we're trying to open up the tissue through the front of the hip here. And release some of the tension between your legs and your torso. Breathing consistently throughout that movement. And we'll do one more here, just massaging the tissues. And relax. Great. So moving on to hamstring on this other leg. You're sitting yourself up as much as you can. So here we're going to floss through the hamstrings. We're going to start off with your toe pointed. So toe is pointed. You're going to push your hip back, squeeze your quad. So you're stretching through the hamstring. If you need to adjust your position at any point, just adjust your position, but you are, that front leg is going to be straight, and then you're going to ease out of it. So squeeze that quad of the front leg as you come back, and then come forward. If there's any discomfort, like nerve-like pain, take it even easier. Don't go down just quite so deep. If you want an increased stretch, raise the toe and drop the head. This is going to help loosen up the hamstrings, loosen up through the back, and with dropping the head, it'll connect into the tissues around about your head as well. We're moving through the nervous system here as you're doing this, moving through all the nerves, through the spine, through the hamstring. Try not to hang out at the back. So as soon as you come back, squeeze your quad and come forwards. There's the quad. Forwards. Okay, and then slowly bringing yourself out of that. Okay, just seeing how you're feeling. Move from side to side. Okay, done one leg. Let's switch to do the other leg. If anybody needs water, feel free to go grab. So again, we're starting off hip width apart. That knee is over my ankle. Big toe glued down. Okay, keep that glued down. See how you feel on this side. Move from side to side. Flat back foot as well. So you're on the top of your back foot. See how this side feels. This side, particularly on my left hip flexor, it's much tighter than it is on the other side. Just an area I need to play around in a little bit more. I know that my adductor on that side's tight as well. It's just something to note, to see what feels more uncomfortable for you. And then again, bringing that foot back into the center. And then moving around in this position, you can put your hand over, you can keep it where it is, but that big toe stays down. Moving through here. See how that feels. Push forwards, push backwards. Find that bit that's particularly tight for you. And then do some really long, deep breaths in there. And then again, we're going to look for a long length. Keep your feet where they are. I'm just going to turn around so that you have a bit better view. Some of you may be able to see that this hip's a bit tighter for me, but I want to create length from this knee through this hip, all the way through here, all the way into the shoulder. So I'm going to stretch myself forwards, get a big deep breath in here, knowing that I have that position and I'm all right in that position. And then I'm putting my hand on my bent knee and I'm rotating up. So I'm going to take some really long, deep breaths here. All the way up through that hip flexor of the back leg. I can feel that in my glute on my right leg as well, my front leg. Opening up all the way through my torso and into my shoulder. And then I'm coming back to the center. Again, keep your feet where they are. I'm just going to adjust my position so you can see. And then from there, I'm going over to the other side. So the shorter side, the side that's going to be bent, I'm going to see if I can get more comfortable with my hip flexion, which will be the lower part of your squat. So when you're squatting, it's allowing your body to know that this flexion through here is an okay position for you to be in. Oftentimes to hit that bottom position, it's like, oh, not there for very long. Think how long we spend in that. The only time that we really spend time there is if we're in a squat during our warm-up or our lunge during our warm-up. We don't usually spend a lot of time there. So the time that we've got here will help with those squats. So stay low. That hand is going to come forward again all the way through your torso. And we're taking some deep breaths here. And with each deep breath, just sinking that a little bit lower. And then we're coming back to the center again. Whoa, have a move around, see how that feels. Might be a little bit uncomfortable, might be a little bit tight. But keeping your front foot in the center, you're going to now butterfly this leg. So again, just move really gradually, really slowly. You want to allow your body to know that these positions are okay. Allow the tissues to relax. So you're pushing that hip out. If you hang out in one area, see how that feels. Again, big deep breaths in this space. Sinking into that hip a little bit more. Definitely feel this one in your glutes, especially on that right side or the side that's at the front. Find that point that's uncomfortable. And you do 3 big deep breaths in here. Fill your entire lungs up as well when you do that. So you're taking a breath in through all the way, expanding your full lungs all the way down into the hips. And then coming back to the center. Now we're coming onto the back toe again of this back leg. Staying upright, keeping that torso upright. Adjust my position. So squeezing your quad and your glute of that back leg. See how much of that position you can have. And as I said, my left hip flexor, I know is much tighter than my right. So it's much more challenging for me to get that glute squeezed. So if the hip flexors are particularly tight, if you're doing any glute work, if you're not able to fully extend through the hip, it's going to be more challenging for you to actually recruit that glute. Just have a move around here. And then again, you're just going to aim to drop that knee towards the ground, just opening up for the tissues, the front of that hip, and then coming back up. So you're trying to stretch and get some movement through this section here. So squeezing that quad, squeezing that glute, dropping that hip down as much as you can, and coming back up. Big squeeze. And that hip down, breathing in that position. And then relax it. Okay, give yourself a bit of a shake. Oh, my hips are tight today. Also, your hips will be tight differently every single day, whether it's depending on what you've done previously, what you're doing, what you've done, what you've done before, what you plan on doing afterwards will depend on what movement you want to do with your hips. And also, did you train yesterday? Have you been sat down a lot? Were you on a flight? These will be really great to kind of add into your day, either in the morning or, for example, if you have got off a flight when everybody can fly again. All right, get into this hamstring. So same again. We are going to floss through this hamstring. So starting off with the toe pointed, pressing the hips back, straightening that leg, squeezing that glute, squeezing your quad and coming forwards. Squeezing the quad and coming forward. So allow you to get that movement through the hamstring, through the calves. It's going to help with the lower back as well. Okay, and then you can lift the toe up, put your head down. Any nervy pain that anyone's getting, just ease out of it. Don't go down quite so deep. Pressing the hip back, raising the toes. Breathing consistently. Good. And then slowly come out. Now stand yourselves up, give yourself a bit of a shake. You're going to be feeling that one. Stand up slowly. Moving steady. Twist there through the ankles as well. Okay, this time we've got one more, or two more movements rather. So we're going to come sideways. So we're going to be in a wide, or you can be however you'd like to be. You're going to be in a wide-legged position. So wherever you've got space. So you're going to be in a wide-legged position. So from here, you might feel this through the adductors, so the insides of the legs, a bit through the hamstrings as well. We're going to put a hand in the back of the head, and we're looking at bringing you down towards that other leg. Now here, you can hold onto your foot if you can. We're opening up through your QL, through your lower back. So from here, big breaths. Pulling yourselves down that a little bit farther every single time, but we're wanting to get opening up through this part of your lower back here. Keep the legs straight. Keep the quads engaged as well. So toes point up, quads are engaged. Breaths in. Opening up through this lower back here. And then on your next breath out, slowly bringing yourself up. Good. And then on the other side, hand on the back of the head. You're taking yourself over. So again, get length all the way through that hip. Drop through the QLs in the lower back. Opening up that chest. You can pull yourself down if you've got the mobility to do that. So you're going to take deep breaths in. Flex the feet. Engage through the quads. One more breath in here. Slowly bringing yourself up. And bend the legs. Bring them back in. And then we are back into our squat. So the squat position that we started in. Let's see how this feels now. How does it feel through the hips? Thumbs up if it's any better. Hoping that it's a yes or a smile or a nod or something. Yeah, fantastic. Good. Yeah, thank you guys. So just having to move around here, see how that's feeling. And now, if you can, let's see if we can get those toes pointing forwards. It's going to be a little bit more the ankles rather than it necessarily being through the hips, but let's just see if it's a little bit easier to be into that position. A good job. That is you all done. Hopefully you're all feeling a little bit more nimble. But yeah, so like I said, breathing's the most important part of the mobility. You can come out of your squat now. I'm going to stay here for a little bit. You can come out of it. Breathing. Breathing and allowing your body to know that it's safe to be in those positions. Really, really important to do. Contracting and relaxing also, again, allows that body to know that that position is safe and comfortable for you to be in. We want to increase your mobility for your strength. And if there's anything for your strength, injury prevention, guaranteed it's not usually the gym that you get the injury from. It's probably bending over to pick something up or pick something in a strange angle. So you want to be able to move. A lot of gym work is generally linear. So let's get some more movement through those joints. If anybody has any particular issues or areas of discomfort that they want to talk about, please make sure to reach out. I'm around to chat at any point. So just, reasonable hours, obviously, but do reach out and we can have a little look at your movement specifically. As I said, anything from hips can be shoulders or shoulders can be hips. So everything is interconnected. So even just a basic assessment might be able to just pinpoint things that specifically might be worthwhile you looking into. And then I know I had the semi-private mobility the other week, and they've all now got homework. So I'm hoping they don't need to do it today if they're on this call, but I'm hoping that they are being consistent with that as well, because the consistency with it. One mobility session is not really enough, but even if you just pick a few things from this, what we've done today, pick 2 to 3 things and see if you can just keep doing it consistently for the next 2 weeks. And you'll really, really notice the difference. But well done. Thank you, everybody, for joining. And I'll see you all probably on Thursday or Friday. Have a great day. Stay safe.
Thanks so much.
Thank you, Louise.
You're welcome.
Thank you, Louise.
Thanks so much.
Bye.
Bye. Thank you.